Just like you looked so familiar to me. I was like, huh.
You may have seen me on like a huddle, a charge huddle.
Maybe, yeah.
I used to work on 90s.
I feel like we probably could find a connection between all of us.
Truly. Yeah.
Hi, my name is Courtney, and I'm a recovery room nurse here at Boston Children's.
Hi, I'm Ruth. I'm a clinical coordinator at Boston Children's.
Hi, I'm Michelle. I am a medical surgical ICU nurse at Boston Children's.
Being a nurse at Children's, we take care of the whole unit. So it's the patient, it's the family. Having kids of my own, I can always feel for a parent when they have a child hospitalized. So having that feeling and then taking care of them helps to empathize with the families.
Some families really just need you to listen to them. We have a lot of medical literacy that we take for granted. And sometimes when the families come in and they don't necessarily know exactly what they need, it's nice to be able to help them.
That's an important part of our job.
Yeah.
And it does, I think that makes the most impact sometimes. In a medical environment where there's monitors, tubes, drains, lines, all these things, I think that families can get intimidated and they sometimes think that they can't do the normal things that they would do with their child at home, or we can't accommodate those types of things. And we can. I think nurses are very creative in how we can create a medical environment into a more like home environment. You know, you take care of a patient that's inpatient for, leukemia, and they come and have a bone marrow aspiration and and you're treating them in the recovery room. And the first thing they want to do is put their princess dress back on, and you do that. You do that for them because that's what makes them feel better.
I'm a big fan of a pump up playlist. We're definitely restricted to some of the play that we can do in the ICU, but we have amazing child life therapists who provide a lot of great things for our long stay patients and our short stay as well. It can be really fun, and music is one of the ways that I like to make things fun.
I love playing hairstylist with my patients. I would wash their hair and do French braids or any hairstyle they wanted, and I thought that was so much fun.
In my department, when you go into surgery, you can go in a Fisher-Price car. Just be wheeled in a Fisher-Price car. I mean, I think that says it all about where we work.
Ever since moving to ambulatory, I do miss working at the bedside, but I did need a change. And so I do love the ambulatory setting. It's a whole new world, and I learn more every day being in there. So I just love that challenge as well.
What drew me to nursing was the mix between science and human connection. I love working in a fast-paced area like the medical surgical ICU. Every day is different, and there are so many different diagnoses that we see and so many different families that we get to meet. We meet people on the best day of their life and the worst day, and getting to spend time with those families and be part of that process with them really draws me to what I do. It keeps me really passionate in what I do. Anytime a patient comes back and we get to see them walking on the unit or they're talking again, it feels so good to know that they're thriving, that they want to share that with us.
I get to see them pretty frequently, which is awesome, because I've had patients that I've taken care of years ago, and they come back and I remember their name and their faces, and I can't believe how old they are and how old I am when I see them. But it's so fun to see them as outpatients and see them living their regular lives.
I remember as a young nurse being very hyper-focused on being a certain type of nurse. I essentially wanted to be Ruth, like the older sister type who was very good at caring for people. And Boston Children's has taught me that there's many different types of nurses. And I think that they do a really good job of giving opportunity to any kind of nurse that you choose to become.
There's a lot of behind the scene things that people don't typically see. If you took a snapshot of just like an interaction with a patient in the recovery room, it's, they broke their arm, they got a cast, they're going home, we're doing discharge teaching. But there's the personal conversations we're having with the family where, maybe they're having challenges at home that come up that's going to affect their discharge, or, maybe they're not English speaking and we need to make sure that they're understanding all of our instructions the right way and that they have the resources that they need at home.
Nurses are advocates for their patients. We are their cheerleaders. We are the number one cheerleader for them. We will go to the top to try to get everything they need.